Cholangiocarcinoma is a rare and aggressive cancer that arises from the bile ducts, which are small tubes that carry bile from the liver to the gallbladder and small intestine. In this video, we will explore the key aspects of cholangiocarcinoma, including its causes, risk factors, symptoms, diagnosis, treatment options, and prognosis. Cholangiocarcinoma is often classified into three main types based on its location. The intrahepatic type occurs within the liver, the perihilar type develops at the hilum, where the bile ducts leave the liver, and the extrahepatic type is found in the distal bile ducts outside the liver. Each type may have different characteristics and treatment approaches. The exact cause of cholangiocarcinoma remains unclear, but several risk factors have been identified. Primary sclerosing cholangitis, a chronic inflammatory condition of the bile ducts, notably increases the risk. Hepatitis B and C viruses, chronic liver disease, and certain inherited conditions also contribute to the likelihood of developing this cancer. Other risk factors include older age, male gender, exposure to certain chemicals, and conditions like bile duct cysts or liver flukes, particularly in parts of Southeast Asia. Symptoms of cholangiocarcinoma can be vague and may resemble other conditions, leading to delays in diagnosis. Common symptoms include jaundice, which is characterized by yellowing of the skin and eyes, itching, dark urine, light-colored stools, abdominal pain, and weight loss. Patients may also experience fatigue and fever. Due to the various symptoms, individuals may experience a significant delay before receiving proper evaluation and treatment. Diagnosing cholangiocarcinoma typically involves a combination of imaging studies and tissue sampling. Imaging tests such as ultrasound, CT scans, and MRI can help visualize the bile ducts and any potential tumors. An endoscopic retrograde cholangiopancreatography, also known as ERCP, may be used not only for visualization but also to obtain biopsy samples. Blood tests, particularly measuring levels of alkaline phosphatase and bilirubin, can aid in diagnosis but are not definitive. Once diagnosed, cholangiocarcinoma treatment depends on the tumor's stage, location, and the patient's overall health. Surgical resection, or the removal of the tumor and nearby tissue, is the most effective option if the cancer is confined and operable. Unfortunately, many patients are not candidates for surgery at the time of diagnosis due to metastatic spread or poor liver function. In such cases, treatments like chemotherapy and radiation therapy may be considered, either to shrink the tumors before surgery, to treat residual disease after surgery, or as palliative care to relieve symptoms. In recent years, targeted therapies and immunotherapy have emerged as promising options for certain patients, particularly those with specific genetic mutations. Ongoing research continues to explore new treatment strategies. Clinical trials may offer access to cutting-edge therapies for patients with advanced disease, so discussions with healthcare professionals about clinical trial options are essential. The prognosis for cholangiocarcinoma varies significantly based on several factors, including the tumor's stage at diagnosis and the patient's overall health. Generally, the prognosis is poor for advanced disease, with a 5-year survival rate that significantly drops for those with metastatic disease. However, when diagnosed early, especially if surgery is possible, some patients can achieve better outcomes. In conclusion, cholangiocarcinoma is a rare and challenging cancer with significant implications for patient health and quality of life. Understanding its risk factors, symptoms, and treatment options is crucial for early detection and management. If you or someone you know is experiencing symptoms related to bile duct issues, seeking medical advice is imperative. Thank you for joining us in this educational discussion. Remember to subscribe and hit the notification bell for more health information.